Well, there's not much time left before Medicare annual enrollment ends on December 7th. And if you're on one of the more than 62 million people enrolled in Medicare, now is the time to make your Medicare coverage choices for 2019. Elena McFan, Regional CEO at United Healthcare and Retirement, is with us today to help you make an informed decision. Thank you, Elena, for joining us.
My pleasure.
Now, this time period can be obviously very overwhelming and very confusing. So let's start with what advice do you have to make this process a little bit easier?
Well, if you're confused, you're not alone, but it doesn't have to be confusing. So first of all, make sure that you review the materials that your current health plan provided you about how your coverage is going to change for next year, your benefits and your costs. Second, make sure that as you look at your options for next year, make sure that your physicians, your hospitals, and your medications are covered, and that you understand at what cost to you. And then third, keep in mind that many Medicare Advantage plans offer coverage, benefits, and services that go beyond Medicare, beyond original Medicare. So many Medicare Advantage plans will offer vision coverage at no additional cost, gym memberships at no additional costs, and dental coverage at no additional cost. So look at the big picture.
Now, for seniors and other people enrolled in Medicare, why is annual enrollment such an important time?
Well, the annual enrollment period runs from October 15th until midnight December 7th. For most seniors, this is their one chance to make changes in their coverage for 2019. And your health care coverage is important not just for your health, but also your pocketbook.
Medicare Advantage, you mentioned that earlier. We've seen a tremendous growth in people going that route. And do you have any reason as to why that might be the case?
I think Medicare Advantage has become more popular because it's convenient. It combines Medicare Part A hospital with Medicare Part B physician into a single Medicare Advantage plan offered by a private insurer. Most Medicare Advantage plans also include Part D drug coverage. And then, as I mentioned, many Medicare Advantage plans offer services and additional benefits that go beyond Medicare at no additional cost. So with a single card, working with a single insurer, a person can have convenience, simplicity, and peace of mind.
Now, obviously, we mentioned that this could be a confusing time, but also a very important time. What are some resources that our viewers can look into in case they want to be a little bit more aware, answer some questions?
I'm glad you asked. I recommend two websites. First of all, to learn more about Medicare overall, I recommend MedicareMadeClear.com. And then to learn more about United Healthcare's plans, I recommend UHCMedicareHealthPlans.com.
Great advice. Thank you so much, Elena.
And a special thanks to United Healthcare for sponsoring that segment.